We love having the latest smartphones and iPads, but one doctor warns they're actually doing us damage with a rise in injuries caused by our obsession with texting.
It's becoming an epidemic.
Warning, drop your device.
They're addicted. I'm seeing a lot of musculoskeletal problems, predominantly from fatigue.
Orthopaedic surgeon Dr. Jonathan Herald has a stern warning for texters, desk workers and tablet addicts everywhere. Put the device down before you hurt yourself.
Now we don't have a fixed base for the computer or the laptop to stay on. We're holding a mobile device, and as a result of this, we're having to use our body to support that mobile device while we use it and input data into it, and that's causing more and more problems.
Hey Harry, how are you?
Dr. Herald says he's seen a spike in patients coming to see him with 4 main problems. Impingement syndrome in the shoulders, which is predominantly related to bad posture and can lead to damage of the rotator cuff tendons. Cubital tunnel syndrome and tennis elbow, both commonly related to keeping your hands in a fixed position above a keyboard. And text neck, a repetitive stress injury caused by holding your head in a downward position for an extended period of time.
So lift your arms up as high as you can go. Let's see how high you can go. Very good. Is that sore at that point?
Yeah, it sure is.
Okay.
Harry suffers from impingement syndrome. His shoulder injury began due to a fall, but says it's only gotten worse because of the many hours a week he spends on the phone and on his tablet, working as a risk consultant.
I'm going to do an impingement test now. It may be a little uncomfortable. All right, relax. 1, 2, 3. Painful? Yeah.
Dr. Herald and physio Jason Mads have been working on improving Harry's posture and strengthening his shoulder blades so that he doesn't have to undergo surgery. This patient has a rotator cuff tear which has been previously repaired, retorn and is being repaired again today. Now, surgery is always the last option for any patient, and for Dr. Herald and his team, it's all about prevention.
The tear is a lot bigger than we originally expected, and so I've had to put a lot more stitches in place to hold it.
According to the experts, there are exercises you can do at home to protect yourself from injury. If you're concerned about your posture,
make sure that the lower back is curved, and then with your shoulders, if you bring your elbows to your sides, just squeezing your shoulder blades back. And then what happens also, I've noticed that the chin sometimes pokes forward, so whilst pulling those back, just tuck your chin in as well.
Try 3 sets of 10 with 5-second holds, 3 times a day. If your thumb is bothering you,
drop your thumb down, wrap your fingers around your thumb, and then drop your wrist down. That's the way.
Like this?
Exactly like that. Then with your other finger, just if you can feel for the tendons.
Around here?
Around
okay,
there's perfect.
Sure.
And then just rubbing sideways over it, and then extend it down the wrist as you go down.
We're not meant to stay in a fixed position for a long period of time, so every hour, I would say have a break. Have a break for 5 minutes. Try and give yourself a physical break, a visual break and a mental break.
how'd it go?
It's all gone very well. Huge success.
He'll be feeling better in no time?
He should be feeling better in no time.